Why does my stomach hurt? Causes and recommendation. Interesting about science and medicine prepared by editorial team over all scientific channel. First reason: high stomach acidity, upset stomach and or gastroesophageal reflux. Symptoms: abdominal pain, burning sensation in the chest pain, especially after eating or drinking alcohol, bloating, belching, acidic taste in the mouth. What can be done? Change your lifestyle, avoid excessive alcohol consumption, take anti-acid medication if needed. Other consideration: to treat this condition, the patient must quit smoking, abandon coffee, cut out alcohol, avoid fast meals. This also applies to fast food. Do not use non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin. Second reason: gastroenteritis. Symptoms: abdominal cramps or pain, nausea, diarrhea, vomitation, fever, lethargy, flatulence. What can you do? Get plenty of rest or drink plenty of fluids. Other consideration: gastroenteritis is an inflammatory of the stomach or intestines, often caused by food poisoning or a viral infection. Children, patients with several symptoms, and the elderly and frail individual may require hospitalization. Cause 3. Gastritis. Symptoms: discomfort, abdominal pain and cramps, pain below the breastbone, possible vomiting. What can you do? Consume only liquid through the day, then slowly introduce more solid foods. Other feature: gastritis is an inflammation of the stomach lining. The main contributing factors to gastritis are lifestyle, smoking, alcohol abuse, overeating, aspirin, ibuprofen, and other medication, bacterial infection. Cause 4. Gastritic ulcer, peptic ulcer. Symptoms: pain in the abdomen or below the breastbone, especially at night or an hour after eating. Pain subsides after eating or vomiting. Black stools are possible. What can you do? You need rest. Eat small meals more often. Use antacids. Quit smoking. Avoid alcohol beverage, coffee and aspirin. Your doctor may prescribe histamine H2 receptor blockers. If you experience black stools, bleeding from the stomach ulcer is possible. Don't delay in calling a doctor. Other consideration: if symptoms recur or the condition persists, testing for Helicobacter pylori may be necessary. This bacterium is considered the main cause of stomach ulcer. Treatment consists of antibiotics. Cause 5. Irritable bowel syndrome. Symptoms: abdominal pain accompanied by diarrhea or constipation, especially after meals. Improvement after a bowel movement. What can be done? To improve a patient condition, the doctor might prescribe soluble fiber laxative or antidiarrheals. Other considerations: the following are very important in the treatment of irritable bowel syndrome. Increase the amount of fiber and fluids in the diet. Physical exercise. Stress is one of the key factors that trigger the condition. This is why many people in modern society rely on meditation, yoga, and other methods. Cause 6. Inflammatory enteritis, ulcerative colitis, or Crohn's disease. Symptoms: abdominal cramps or pain, fever, loss of appetite, weight loss, diarrhea, flatulence, rectal bleeding. What can be done? Call a doctor immediately. The patient requires an urgent medical examination and treatment. Other considerations: some alternative medicine practitioners recommend drinking green vegetable juice, which are rich in chlorophyll, which can significantly improve the patient's condition. In several cases, surgery may be necessary to partially or completely remove the diseased intestine. Cause 7. Inguinal hernia. Symptoms: sharp, persistent pain in the groin, abdominal swelling visible when the patient is upright or during physical activity. Other feature: with this disorder, the intestine or other internal organ protrude through the abdominal wall. Cause 8. Gallstones. Symptoms: sharp, spontaneous pain in the upper right abdomen, especially after a fatty meal. The pain may radiate to the right shoulder blade and may persist for several hours. After the pain subsides, a general feeling of tenderness develops in the abdomen, nausea, vomiting. What can be done? See a doctor immediately. A patient with these symptoms requires a medical examination for a diagnosis and treatment. Treatment may include gallbladder removal or a special technique to dissolve gallstones. Other feature, it is necessary to reduce the amount of meat and fat consumed and to eat more foods rich in fiber. It can reduce the risk of developing gallstones. Cause 9. Pancreatitis symptoms. Sharp, constant abdominal pain radiating to the back and chest. Fever, nausea, vomiting, bloating, cold, clammy skin. What can be done? Call a doctor immediately to prevent possible complication or even death. Other features, the main cause of pancreatitis are alcohol abuse, gallstones. Eliminate fatty foods and alcohol from your diet. Cause 10. Diverticulitis symptoms, sharp pain in the left side of the abdomen, chills, fever, nausea, constipation. What can be done? Call a doctor immediately. Some severe cases may require hospitalization and surgery. Treatment for less severe cases include the following recommendation: bed rest, laxative, liquid diet, antibiotics, antispasmodics. Other consideration: a through food intake should be minimal. During inflammation, high fiber diet has a preventive effect. Cause 11. Kidney stones. Symptoms: sharp pain in the side radiating to the groin and or abdomen, frequent and painful urination, problem with urination, cloudy and full smelling urine, blood in the urine, fever and chills, vomiting, nausea, profuse sweating. What can be done? Call a doctor immediately. An urgent medical examination is necessary for diagnosis and treatment. Typically, the first step to recovery is drinking plenty of water and taking an analgesic until the stone is passing. Other features: surgery may be necessary in the following situation: infection, blockage of a kidney duct, large kidney stones. A new treatment method uses high-energy shock waves to crush stones without surgery. Cause 12. Urinary tract infection. Symptoms: lower abdominal pain accompanied by a frequent and painful urination, a constant sensation of urination, sometimes blood in the urine. What can be done? There is a risk of a urinary tract infection with the following symptoms: fever, chills, back pain, possible nausea and vomiting. Call a doctor immediately. Other features: pregnant women, diabetics, and people working in nursing facility are at increasing risk of a complication from a urinary tract infection. Cause 13. Hiatal hernia. Symptoms: pain radiating from under the breastbone, in the neck and arms, vomiting, belching, flatulence, difficulty swallowing. Other features: the most important lifestyle change that can improve a person's condition are quitting smoking, abstaining from alcohol, eating small meals more than 2 hours before bedtime. Reason 14. Menstrual cramps. Symptoms: pelvic cramping during menstruation. What can you do? Take a pain reliever such as aspirin or ibuprofen. Other considerations follow may help: manual therapy, acupuncture, magnesium supplement. If your periods are very painful, your doctor may prescribe a prescription anti-inflammatory medication. Reason 15. Acute emergency situation. Acute emergency can cause abdominal pain, include poisoning, diabetic coma, chemical burn, anaphylactic shock, perforated gastric ulcer, rupture of ovarian cyst, rupture ectopic pregnancy, intestinal ischemia, abdominal aortic aneurysm, myocardial infarction, intestinal obstruction, appendicitis, and peritonitis. Symptoms: several abdominal pain, which may be accompanied by other symptoms. What can be done? Call an ambulance immediately. The patient requires immediate medical attention. Thank you for your attention. This material is based on the material from the channel All Scientific. Caution: before using any treatment method or medication, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.